friends, hi, welcome back to Alpha Physio Pelvic Care, all things pelvic health. My name is Anastasia Varova and I am pelvic floor physiotherapist in Cyprus as well as online. And today, an exercise along video. And this video I have created especially keeping in mind the request I usually get. And the request is, can I have a hip release exercises without going onto my knees, without going on a 4-point kneeling? It's usually a very valid request. It can be new moms who are suffering from some postpartum knee pain. It can be somebody who just has knee issues and they don't want to lead, but they still want to do things to release their pelvic floor, to mobilize their hip and low back area without straining their knees. So today, with my exercise along video, we're going to do exactly that. I will show you 4 amazing exercises without needing to kneel. All you will need is a mat and a chair. And this is it. You can do all of them. You can pick and choose some of them. You can do it as a complex, and it's great exercises literally for anyone. You can also do it when pregnant. The only one I would take caution, the one on the back, the bridge, you will see, especially if you are getting dizzy and if you are in the 3rd trimester, maybe skip that one. But the rest you can even do in pregnancy. You can do it if you do suffer from some pelvic pain because they're very flowy and aimed towards mobility. If you have sitting job and you sit a lot, if you're going through menopause and you feel like you're overwhelmed with the whole information about pelvic floor, or you would like to start to do something around your pelvic floor. So let's do it together. But before we do, if you watch my channel, if you watch my videos, I would really appreciate if you hit that like button right now. Subscribe to my channel not to miss any videos. I promise they're all really useful and I give my best tips and tricks. And if you need a personal consultation, and if you don't happen to live in a beautiful sunny Cyprus, we can always meet online, and there is application form in the description below. The first exercise, we're laying down onto our side. Here I'm going to support my head with my right hand and my left hand will be on top. And what I will start to do is I'm going to start nice and deep, slow breath in, opening my left arm and bringing my left leg up forward with the knee bend. So I'm taking it more closer to my body and keeping it slightly open. So breathing in. As I start to breathe out, I drop my leg. I'll take it closely to my other leg and then I move it upwards. All right, so almost making like a bit of a smiley shape with my leg, with the knee bend. And let's combine this whole thing together. So we're breathing in and breathe out. And of course, you see which range is comfortable for you. You can make smaller movement, you can make full amplitude movement, and breathe out. Whoop, my hip just clicked. Breathing in, open, breathe out, close, and breathe in. As you can see, everything moving. Your thorax, your hips, even your knees are kind of staying the same, they're bent. Breathing in and out. The reason why I'm keeping the knee bent, if you have straight leg, you have really quite a bit of tension going on here around your hamstrings, and also heavier leg, heavier on the hip. So if we reduce the lever, okay, we are making it as a bit easier. Breathe out and breathe in. And let's do 3 more. Breathe out and breathe in. I'm here not dwelling a lot on my position. As soon as you are moving and opening your elbow And by now my hip is already tired, which indicates to me that about 8 to 10 reps is enough, and we are good to go on the other side. I'm going to turn with my bottom here so you can also see the movement from behind. So I'm holding my hands here and I'm starting to open, breathing in, opening my side. You see my knees slightly up, and as I breathe out, lifting up and breathing in and breathing out. And in and 3. This is great exercise as well for your pelvic floor, for your glutes, and in pregnancy, perfect, you can do that. Everybody can do that. Kids can do that. Adults can do that. Somebody with osteoarthritic knees can do that. With a knee replacement and healed hip replacement, you can do this exercise. I mean, it's really, really universal. Even your grandma can do it, and even if you can't get yourself on the floor, you can do it on a firmer bed. I wouldn't do it on a very soft bed, but if your bed is quite firm, yeah, you can do it on the bed as well. Let's do one more. Breathe in. And again, here, as I was talking, I didn't really count, but I approximate 8 to 10 repetitions. And we go on onto our back. So again, not a lot of involvement of the knees, so not knee weight bearing. You will weight bear onto your feet, and usually in order to get the glutes kicking in, we hold our heels quite close to our bottom. If this is uncomfortable for you, if this is too much of a knee bend for you, I am fine if you hold a bit of distance. Keep your feet hip width apart whilst let your knees get stuck together. And here we breathe in and breathe out. Come up and open, and as you breathe in, vertebra by vertebra drop and let your knees come together. This is an amazing pelvic floor exercise as well. Breathing in. This is the only one where you have to be careful, especially on the second and third trimester, just for the sake of, not getting dizzy. It's not a long time that you will spend on your back. So if you feel comfortable enough, you can do this exercise for 8 or 10 reps if you're heavily pregnant. Otherwise, you can skip it and do it later. And breathe out. This is great exercise also in menopause. Gets all that blood going around the area, and we need a lot of blood flow in there. We need a lot of hip mobility. There is a lot of hip tension happening as well as a protective mechanism of the pelvic floor. Breathing in. And generally, if you maybe suffer from painful intercourse, this can be addition to your therapy as well. Lovely. And that is, we're done. Nice 8-10 repetitions, and let's grab our chair. And as I promised, no kneeling. It's my chair, and the reason why we're using it, we will replicate something that we would do on the kneeling, but it's also something that you can do right on the go. You're waiting for a kettle to boil, grab a chair, do an exercise, we're moving on. You're in the office, and maybe you put your hands on the table, do a bit of stretch, and you're ready to go. So this is really easy setting, even if you don't have a mat, just a chair or a bit lower surface, and you're ready to go. So here I'm going to let my back arch, and I'm bending my knees, and I'm going to go under. I'm making a wave, and then I'm tucking my tailbone in, rounding my back, pushing away. Breathing in and breathing out. Breathing in and out. You do partially support yourself on your hands. If you have issues with the knees bending too low, you don't have to. You can just relax them slightly and do just the wave. breathe in. Most of my clients are able to do these exercises with the knee bend, okay, with some support in the chair. Few of them will struggle with the kneeling, yeah, right, having the weight on the knees. And we're doing nice wave, breathing in, tucking your tailbone in. And here we stay here, and I'm now leaning on my left leg. I'm gonna turn a little bit like this on the side so you can see better. So I'm twisting, okay? Right leg is straight, left one is bent. And back again. I'm twisting, breathe in. Breathe in. In. Twist it. Breathe in. Twist it. Breathe in. Nice. The reason, of course, we can do it in standing, you know, here, but it's different because we don't have this tension going through the hamstrings. We want to add a bit of hamstring tension. And the pelvic floor here is a little bit neutral position. It's not that much against the gravity as it would be when you be standing. So more neutral position, breathing in pregnancy, just great. Especially, you know, a little bit stretch in the office, a bit stretch whilst, you know, your kettle is boiling, letting the belly kind of relax here, taking the weight off the back. All right, and we shake here a little bit. Shake, 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 shake. All right, and we are done. We are done, and I kneeled here on my knee. Something that we're not doing in this video for purpose of landing on the floor. So that was it. That was your hip release. Nice and easy and fast. You can use all 4 exercises. You can pick and choose which one you prefer. They, as I said, they're universal. They're great for almost any population. Let me know if you tried any of them. Let me know if you struggled with some movements. If you do have pelvic floor issues that you would like to address with a specialist, you can check in the description below, link to the document, and it's a short questionnaire that you can fill up, and I'll come back to you and we can arrange online appointment if you are not happen to live in sunny Cyprus. And thank you for watching. Thank you for your time. I hope it helped, and we'll see you back very, very soon. Bye.